this week.
I'm so excited.
We are live, by the way.
We're live right now. Good evening, everybody. Welcome to the first USS Town Hall. So exciting. I am so excited to be here with all of you tonight. My name is Caroline Lohr, and I am the president of the Undergraduate Student Senate. I want to really quick give a shout out to our special programs director, John Fraser. He has done all the man work behind this, has been incredibly great with it. And he just coordinated the whole thing. He's amazing. So if you see John in the future, make sure to give him a lovely pat on the back. Let's see. Yes, the town halls will be something that we at the USS value and appreciate. In the future, we will have multiple other town halls following different topics like Title IX, financial aid, and anything else that you, the students, want to talk about. We appreciate every person who has submitted a question. If you have additional questions, there will be a live stream chat. Please feel free to use that to ask more questions. I want to briefly go over the Undergraduate Student Senate and share how we are different from any other student government in the nation. We are the only unilateral government in America, and through this structure, along with our values, we promote unity, inclusion, and equity. Our mission is advocating for the undergraduate student body for any charge. This town hall is an example of how we value your voice and to emphasize how important your voice is. With this in mind, USS has spent the past 2 weeks collecting feedback from the student body surrounding COVID, and specifically the university's plans to support and protect students, which has informed the questions that will be asked tonight. Now, going on to who these lovely people are. Tonight, we have with us Dean of Students, Dr. Byron Hughes, and Assistant Vice President of Student Affairs for Health and Wellbeing, Chris Wise, who will be answering questions from our student moderator, Sydney Livingston, a USS Senator for the College of Liberal Arts and Human Sciences.
Hi, everyone. I'm Sydney Livingston, and I'm going to go ahead and read our land acknowledgement, and then we can start with the first question. Virginia Tech acknowledges that we live and work on the Tulalip Monacan people's homeland, and we recognize their continued relationships with their land and waterways. We further acknowledge that the legislation and practices of the Morrill Act 1862 enabled the Commonwealth of Virginia to finance and found Virginia Tech through the forced removal of Native nations from their lands, both locally and in Western territories. We must also recognize that enslaved Black people generated revenue and resources used to establish Virginia Tech and were prohibited from attending until 1953. Through inclusive VT, the institutional and individual commitment to ut prosum, that I may serve, is the spirit of the community, diversity, and excellence. We commit to advancing a more diverse, equitable, and inclusive community. Alrighty, so I guess we'll go ahead and get started. Caroline, did you have anything else you wanted to add?
I am all good. Let's get the show on the road.
Okay, awesome. So welcome, Dr. Hughes and Mr. Wise. Super excited to kick things off. So to start off, earlier this week, President Tim Sands, he released a statement regarding the future of the mask mandate at Virginia Tech. As implied by his announcement, the mandate will be lifted, and this release sparked a variety of concerns from the student body. So our first question is, we just want to know how you plan to prioritize the safety of the student body moving forward regarding masks, vaccines, and testing.
Byron, you want me to take the first question?
Yeah, go ahead.
Well, first of all, let me say thank you all for inviting me to join you today. And thanks to all the students that are tuning in to this important thing. And certainly thanks to USS and the work they've done. And we're really excited about these. And I know you all are too. So Sydney, I appreciate that question. And I know there was probably a lot of different feelings when that announcement came out earlier in the week, to go along with feelings that many folks have had, throughout this semester, as some things have kind of changed to affect people in different ways. But I think it's important to know that regardless of the mask mandate and some of the things that have happened, we at Virginia Tech, and we in the leadership, and those of us that are working, for example, in Shifford and some of the areas on campus, will continue all of the mitigation strategies that we've had in place. The vaccine mandate was also lifted, but by the time it was lifted, or I'm sorry, the booster mandate, but by the time it was lifted, the majority of our students, over 70% of them, already had the booster. And of course, 90-some% have the 2-dose vaccine. We are continuing to encourage students and faculty staff to both obtain the booster or obtain the vaccine if you have it, and also to report those so that we can keep our statistics on the dashboard accurate. And at that point in time, some people were worried that testing would also end. And that is not our plan whatsoever. Testing is still a very important strategy for both students and employees and people all over the country, really, to use when they feel like that they are either a potential exposure to COVID, or if they feel ill and want to double check and make sure where they're at. And so we will continue to have testing 6 days a week, just like we always have. Obviously, it's not mandated now for the non-booster because we haven't mandated the booster, but we're still testing well over 100 people a day, and we'll continue to do that throughout the semester. We have no plans of ending the testing or any of that kind of thing. So, and then I'll touch on the mask. I mean, that's the most recent and the one that I think most people might have on their mind today. But the reality of the potential, and I'll still say it's a potential, of an indoor mask mandate being lifted here, does not mean that we won't continue to encourage people to mask in the settings that they should. Of course, that could be classrooms, and I certainly would encourage people in especially large classrooms to continue to wear a mask, and in all the other settings on campus that make sense. But what you're seeing is the movement of responsibility from not only here institutionally, but at universities all over the country and certainly all over the state, from an institutional kind of response to trying to control illness through the COVID virus, to a combination of some institutional mandates and control and things that they're doing, like continued testing and all those things that we're providing for free, but then also some personal responsibility in how you as an individual might work to protect yourself from COVID. And the reality of it is, when you're kind of in my world over here in Shifford, masks protect you from a lot of other things besides just COVID, and including the flu and some other things that can really affect your semester. And so we'll continue to encourage people to do what the right thing is for them. And we will continue, the university leadership will continue to monitor the dashboard and all the information that we're collecting. And it does not mean that a change might not go back the other way, depending on the numbers. But I will say that our numbers have changed dramatically, and I can talk to that if you want me to in a little bit, but have changed dramatically in the last 2 weeks. And this is the same thing that we've seen really now. This is the 4th semester that we've started, and we've seen this big uptick right at the beginning of the semester. And then you get into about this time of year and it begins to go down. So I'll stop with that, but I'll say we still understand our responsibility, and we're trying to kind of spread that out now over personal responsibility and institutional responsibility.
Thank you so much, Dr. Wise. It means a lot to know that y'all are still going to be monitoring with the dashboard, and of course, still offering testing. But next question is, what are some of the options for, oh, my apologies. Will student organizations and professors be able to mandate masks just within their own offices, classrooms, or meeting spaces? And if you guys would like to both comment on this, that would be awesome.
Well, I can get started, and similar to my colleague Chris, thank you all so much for hosting this dialogue. I really do appreciate the direction that our student governance has moved in terms of being able to just lift up opportunities for the community to have dialogues like this, and to have certainly student leadership that are responsive to what's happening in the community, and to build a strong relationship with the administrative team here. So, in answer to your question, Sydney, this is a good question because I think we kind of dovetail off of the point that Chris made regarding kind of institutional management and personal responsibility. So, as far as an employee of the university, whether that be a faculty member, whether that be me, anyone that's an employee of the university, we're not going to probably increase a policy or expectation beyond what the university has already set forth. So if the masking requirement is lifted, then, as an employee of the university, I'm going to comply with that. And I am always acting on behalf of the university and whatever I do on campus, whether it's a formal conversation or formal meeting with a group of students, or if it is just even informally kind of being with them. Now, as it relates to our students, though, that's a little bit of a different scenario. So if a student organization decided that it wanted to make that as a requirement when they are convening together, they certainly can. And, I don't necessarily know that we would get involved in how that student organization decided to manage that. But of course, through good advising, what we would say is that, you want to make decisions that the whole group can be supportive of. So if, there is someone who does feel pretty strongly that would be against their right to do. And, right now we're working through, you see across the country that states are kind of moving in the direction of saying that, of not being able to force people to mask. So we would say that, to work with where people are. But again, if we go back to personal responsibility, what that means is that perhaps with a good fitting KN95 mask and being vaccinated and boosted. And of course, with the opportunities we have to be able to treat COVID-19, I think that people can feel pretty comfortable in saying, even if I'm sitting in a student organization meeting, I'm going to still put a mask on. And I'll give you an indication of this. I advise a student organization on campus, and I was within their fraternity house actually a couple nights ago. They are not required to mask in that space. That's been kind of our expectation when it comes to our residential communities on campus. And I wore a mask, and I wore a mask because I've got immunocompromised individuals at home, and I've got a small child as well. And so I decided that I was going to mask up, but certainly they decided that they weren't going to, and some still do. So again, I don't know that we would necessarily say that yes, please go out and create mandates on your own, but I think simply being sensitive to what does it take to be able to mitigate, the impact of COVID-19? And I do think that masking is a very important piece of that. But there are also some other aspects here. Now, in general, I would say that if you're just simply trying to be safe from just about everything, then yeah, it would make perfect sense. But part of moving to personal responsibility is encouraging students to make best choices for themselves, quite frankly, as well as employees too, for that matter.
Yeah, and Sydney, the only thing I think I would add is I think there will be some places that will continue to require masks. So obviously public transportation is one of those. My office here is in Schifert. And so even though I'm not a doctor, I'm an administrator in a building that's a healthcare building, people will continue to be asked to mask in a place like this. And so there are some strategies that are still in place and will continue to be in place, both here and throughout, the state at least, more of our medical decision makers are making those decisions that those are still high populous, closed in environments or whatever, or still a place where COVID is more likely to be spread. And so we will continue to offer masking responsibilities in those. And, I'll just reiterate what Byron said about KN95s or N95s. And I think Caroline's modeling one for us tonight. So really KN95s have really proven to be very protective to the actual individual. And I know that if you're like me, and I think we all, have had different confusions throughout the last 2 years when one thing is said about a mask and another thing, and one of those things at one point in time. And I think we as a country really got to where we were at. But we talked about whether the masks are protecting me, the wearer, or you, the person that's in the room with me. What we have learned about KN95s and N95 masks are they indeed protect the person. And so I hope everybody's aware. And if you're not, talking about institutional support, we have bought over, I believe, 50,000 KN95s to distribute to faculty, staff, to students, and all sorts of places. I think USS has helped us distribute some of those. They are still very much readily available at a few pickup locations. And I would encourage folks to look into those and make sure that they get those, because I think that's a real protective effort that gets back to that personal responsibility that Dean Hughes talked about.
Yeah, thank you so much. That makes a lot of sense and definitely clears up some of the questions that we had just regarding the safety of the students. But I know you said this earlier. I just want to also touch on this again. So for the large number of students, say university employees or just RAs, dining services, just staff that come in contact with a lot of other students and a large number of people on a daily, how are you planning to prioritize their safety as well with the mask mandate being absent?
I think it goes back to, we have been and we will continue, certainly, particularly for those that are employees that are in those frontline opportunities and roles, to be able to have them wear KN95s, again, if they choose, because again, there might be some who say I'm completely okay and fine with not doing it. But certainly, again, if the masking requirement is lifted, it does not, again, change our ability to be able to support those who want to have a mask, right? And particularly those that are working, like our RAs, our dining services employees. Chris Wise leads an incredible team of student leaders that are working in our recreational sports area that are always certainly up close and personal with students. So that will continue to be there, Sydney. And again, because they are working on behalf of the university, but even for those that may not be working on behalf of the university who still want to have that KN95 mask, and we want to be able to support them and to be able to provide that too.
Yeah, thank you so much.
If I can just add one thing too, and I mean, I can only speak for the student employees that work in the areas that right now I supervise, but at my leadership team meeting this week, we talked about this because that announcement came out prior to, and we had this conversation about what that might mean for student employees versus what that might mean for students who, for example, use the gym, or for example, use some of our other areas in Hokie Wellness who do presentations. And the one thing that I've encouraged our team to do is that needs to be included in part of their training too, is how do we, what is our expectation of ourselves versus our students, and how do we continue to make sure that our students understand all of the options that are to them to help keep them safe. And so it might be one of those kind of things that prior to COVID, we didn't really talk about communicable diseases and close relationships with people as we work or whatever. But now what we've learned is we probably should have always been, and we certainly should be now. So opportunities for the shields that we have, we won't take those away. Opportunities for distancing in some ways that we won't take away. Certainly we can't we can't go back to where we were 2 years ago with distancing and things like that, because it really does erode the on-campus experience that I think many students really want here. But we can train and educate our student staff so that they can help students understand too. And that'll probably take some time because again, that's not something that we necessarily felt like we were doing in early training or whatever, but I think that's an important piece of it now. That, and again, student organizations can do some of that same work with their groups to help people understand that kind of personal responsibility, and also what mechanisms we can put in place to help keep people, as healthy as possible.
Yeah, thank you all so much for responding to that as well. Going forward, if the mask policy, the removal of the mask proves to be effective, is there a plan for the future necessarily about mitigating that a little bit better?
Yeah, I'll start first with that one. Yes, as I mentioned earlier, I think so there's a COVID response leadership team that meets regularly, and their meetings coincide with how cases and how things are going on campus. And so, they're back down to more like 2 times a week, but, in the really tough times of this, they meet every day, and they are looking every day at the numbers. That's why the dashboard's out there. I really encourage students to keep an eye on the dashboard, because that is what the university leadership's keeping an eye on. And there was a time that we were using the dashboard to make decisions based on number of cases. But if you haven't been there in this semester or in a few weeks, I encourage you to at least go take a look at it. Because one thing we're tracking through Schifert now is actually severity of cases. Because what I think we all know is it's going to be hard for someone to protect themselves from getting a coronavirus like COVID forever. I mean, that simply will be hard. We didn't know that at one time, but now we do. But what we are more concerned about now is not how many have it, but what's the severity and how many severe cases might we have. And so the dashboard is what leadership uses. And it has been pretty clearly known to me that group says, depending on what might happen with severity and with case numbers, there is a chance the mask mandate could come back. Now, I say that wanting to make sure that students understand that, Virginia Tech as a public institution in the state of Virginia, has a governor and has a state legislature, which I think Caroline's going to visit here soon, and maybe some other folks from USS that also have, that we also answer to. And, so it's a fine road, but even the governor, when some of these changes have been made, has said that if cases continue to be severe or start moving into severe direction or in case number direction, that even at his level, there would be potentially a change back to some of these mitigation strategies that are being relaxed right now. So institutionally, we would do the same thing. And so my key point on that is the dashboard is key. And so if folks really want to kind of keep an eye on that, they can. And, I've got it pulled up right now. And right now we have what we call 29 active student cases and 36 active employee cases. But that's all that means is there's been that many within the last 10 days. So that's a number that stays up there no matter whether you're severe or any of that kind of stuff. But what I can tell you, because I get the numbers every day to me, is, for example, today I've got the report from Dr. Sharon Sari, who's our chief medical officer today. And so today we only tested 11 people for COVID. Now that doesn't mean, when I say that, that's the results we've got in. So more people may have went to the test sites, but we had 0 positive cases today. And if I walked back 2 or 3 days, it's only been 1 or 2 each day, even sometimes when we've tested 100 to 120. And so again, as it's creeping down, it's making leadership and the report on the dashboard look more favorable to some of the movements that we're making. And I'll just finalize with this. In the fall, quite frankly, very late in the fall, maybe right before Thanksgiving break or somewhere in there was conversation about, even though nothing had changed at the state level, there had been conversation about maybe we could reduce the masking at that point. And of course, Omicron came about that same time. And we checked ourselves a little bit as an institution to make sure that we didn't make a mistake. And so we did not reduce the mask then. And so there is already evidence of that leadership group using cases and variants and all the things that have gone along with this to make the best decisions that we can make. And I'm positive that they'll continue to do that and that we'll all be able to support that.
Awesome. Thank you so much. Just a clarifying question. The dashboard is on the vt.ready.edu site, correct? Awesome. Okay, great. That sounds like a great resource for students and faculty to keep using. So continuing on with our mask-centered discussion, some students, upon the release of Tim Sand's statement, have expressed that they are afraid to go to in-person classes. Are there any concessions or compromises that will be made for them?
So I think, we're going to continue to operate kind of how we have, which is let's talk through kind of what the concern is, and I think I feel pretty confident in this, that when we think about COVID-19 transmission hasn't occurred in the classrooms. So when you look at the numbers of cases that we have had going all the way back to fall 2020, when we brought everybody back to campus and people were starting to interact again in residential spaces, off-campus spaces, eating meals together, the COVID-19 transmissions were happening in places where people live and play, and that's where the transmission occurs. It actually isn't in the classroom spaces. And part of that, of course, has been because of the masking requirement. Now, granted, obviously, if there's a lifting of that masking requirement, again, if we go back to what we know to be true about our KN95 masks, of course, is that our N95 masks is that will do a very good job of being able to take care of that person who does have that concern about sitting in a classroom with a bunch of people around them, again, without the spacing that's available. But I'll also continue to say that, again, if you're thinking about it in the classroom, then you're probably also needing to think about it in terms of where am I, on campus? So, if you're eating lunch with people and, of course, you're not going to have a mask on while eating lunch with people, you stand just as much of a chance of being able to get COVID-19 at that point as in any other place. So I say that to mean that, I think that if a person is considering they don't want to return to the classroom if there's a lifting of the mask mandate, well, then they probably will also they would need to start thinking about the rest of their life here at Virginia Tech, right? Because they don't necessarily know, we can control certainly for what happens in campus spaces, we can't control for what happens certainly beyond that. The other aspect of that too is that certainly if there is something that is happening with a student, then we would encourage them to work with academic advisors to look at what is the possibility of being able to choose either hybrid courses or to choose completely virtual courses based off of what's available out there. And so, we have certainly a number of courses that were always taught via virtually in some way. Virtually wasn't Zoom before COVID, but it was some sort of virtual component. And, we have more classes now that are being taught that way, certainly because we also know too that is a component, that modality that can work. A hybrid modality can work as well. So I think we would say look at the opportunity certainly to be able to take virtual classes if a person is concerned in that particular way, but also realizing that we're going to be living with COVID-19. It's not going to go away, and we are in a much better place now to be able to help people that get COVID-19. And the data here at Virginia Tech is comparable to the data that is out there across the United States. And regarding if you have a 2-dose vaccination along with the booster, if you're going to get COVID-19, you're not very likely going to experience anything that would be considered a severe symptom. You might be in the mild to moderate, but you're not going to be in the severity way. Now, of course, that doesn't always account for those that may have other health issues that are going on. But again, there have always been ways to be able to help students think about if they are immunocompromised, how might they be able to access Virginia Tech, in a way that is safe for them. So I don't know that we would compel, for example, a faculty member to, I don't think we would ever compel a faculty member to provide an online option to a student in a course, but we can work with that student to figure out what are their options to be able to participate and to do so virtually, or to consider how they can best protect themselves.
Yeah, awesome. Thank you so much. So following up with, I know you touched a little bit on the virtual hybrid setting. I would love to know if professors are going to be required to offer those hybrid classes to better accommodate their students, or even themselves if they are just worried about, health concerns and catching COVID.
Yes, I don't believe that we would require it. I think prior to COVID, we didn't really have much conversation about hybrid because I think people never thought you could do this. And then we went into the height of the pandemic, and certainly things were done virtually. But to be able to offer a hybrid, if a course is designed to be hybrid, then it can make perfect sense. And there are probably a lot of classes right now actually that are more hybrid, meaning you could probably do just as much work in a Canvas portal, or you're watching asynchronous, kind of recordings of lectures, in addition to certainly things that you might be doing in class. But to be able to offer a hybrid opportunity to a student requires a lot more. So for example, not every class is taught in a space that has a Zoom capability along with it. And so that may not necessarily be available to a student or to a faculty member to even make that adjustment for a particular student. So again, we would never require that. If a faculty member wanted to design a course in a hybrid way, particularly if they have concerns, whether it be about COVID-19 or again, about what best contributes to the learning experience for that course, then they would certainly work through their department within the college to determine if that's okay to do. And again, they would have certainly that opportunity. But in general, I would say that we would not compel a faculty member to offer hybrid, I think, options for students. And again, same thing goes back to kind of how I previously said. We want to work with the student to best understand how do you pick the courses that, again, work best for your lifestyle and what you're attempting to do.
Yeah, thank you so much. So I know y'all had mentioned earlier regarding the Virginia Tech dashboard on the VT Ready site. Do you have any information if there will be a better reporting system just to ensure the numbers are remaining consistent and that students are not becoming super spreaders in their large lecture classrooms?
I think right now we have a pretty good reporting system. We not only have the reporting system of people who test positive and their severity who actually test through one of our programs on campus, but we also have through the Dean of Students, and Byron could probably speak a little more to it than I can, but a platform, if you will, for people to report in what their situation is so that we have a pretty accurate report of both on-campus and off-campus students. So students who may use a home test or now that they're a little more available, or may go to a physician in town or to Velocity or somewhere. We are able, as long as students, report it out, to continue to use that data to compile into the dashboard. And so I just kind of want to clarify that dashboard is as complete data as we can get, not just simply from our own Shepherd Health Center or our own testing sites that we've developed on campus. And so I don't know that we're going to do anything new. I think the improvement that you might be asking about is the one that we made this semester when we said, hey, let's go deeper than just number of cases and percent positivity, and let's start talking about the severity of illness. Let's start talking about the percentage of vaccination, 2 doses, and let's start talking about the percentage of boosters. And so again, I don't know if folks have had a chance to look at that page, but I mean, it's significantly different than what it was. And of course, the institution uses that. Now, they have some background information too that we don't necessarily publish. For example, if there is a severe case, then there's conversation that goes on. There's support that Dean Hughes' team gives. There's support that Schiffer gives. And all that information is also provided to that COVID response team to make decisions on. And so, of course, we're not going to get real specific on a dashboard about, the severity of cases or whatever. But I can tell you that at Virginia Tech, we have only had 1 or 2 throughout this entire COVID 2 years now that would list into that severity case, which means someone that required a hospitalization. And so we have that backup data, but we're probably going to use what you see on the dashboard primarily, and I feel pretty comfortable with that, and I think the university leadership does as well. But we, just like students, and I think it's great that students do this, are constantly paying attention to the CDC, paying attention to what's going on at different levels, paying attention to the waves as they move across states and areas. And interestingly enough, throughout most of COVID, Northern Virginia's been significantly worse in Richmond and Tidewater than what Southwest Virginia has. But interestingly enough, back in early January and through January, Southwest Virginia caught a wave that we hadn't really caught, where Northern Virginia felt more comfortable with where they were versus where Southwest Virginia was. And so that is tracked as it goes. Our emergency management team here has done a great job of it. Our health center does it. And then, of course, President Sands and his leadership team that has the COVID response team has a lot of access to a lot of data that they continuously use.
Awesome. I think that'll make a lot of the university feel so great knowing that they have a really effective, up-to-date dashboard. So that's really great to hear. Thank you so much. So we did receive an audience question. So I'm going to go ahead and ask that question on behalf of the audience member. So this is touching back on the in-classroom hybrid methods and just in relation to COVID health concerns. So how are y'all going to support faculty who want or need to accommodate students who no longer wish to attend classes in person?
I think, I still go back to, we need to work with individual students, I think, in these scenarios, because again, if you're not wishing to attend in-person classes, then you're probably also not wishing to do anything in person at Virginia Tech, right? Which would include where you are, and where you're living and that sort of thing. Again, those are spaces obviously the students can control. Ultimately, a faculty member has discretion over how their course is being taught. If a student has an accommodation through services for students with disabilities, then in that case, obviously, that would be something that a faculty member would be obligated to follow. But I think even there, I would say that even as I work with our SSD team and that office reports to me, they're generally asking some real questions about, about your disability, about what's happening kind of in the context of your life, and about what would be considered a reasonable accommodation for a faculty member to be able to make. So again, if you have a student that says, I no longer wish to attend in-person classes, I don't necessarily know that the automatic answer to that is, we need to have the faculty member create a virtual opportunity for them to participate. There's probably something that is in between, and the something that's in between is there could be other sections of that course that are actually taught, for example, virtually. Or it could be that perhaps there are other classes that you can take as part of your academic program that would be virtual, that would meet certain requirements. So again, if it's a reasonable accommodation, that's very different, and there are certainly standards for that. But again, the idea of not wishing to attend in-person classes, sorry about that. COVID-19 isn't going anywhere. It is certainly here to stay. We know a lot more about COVID-19 this year than we did this time last year, when we were kind of rising to our peak, and we were at lesser capacity in our residence halls and certainly lesser capacity in our classrooms. There's just a whole lot more that we know now that we did not know then. And so let's work with the individual students. If there is an individual student that does have that concern, then they should reach out to the Dean of Students office. They can reach out to, again, if they are a student with a disability, they can reach out to our SSD team, but they can reach out and ask the question about their particular situation and about their particular academic program. That's the best way to be able to address that, rather than kind of a sweeping, faculty members, you must provide an opportunity for a student who does not wish to attend in-person classes. Again, I think that's typically the best way to do this. And this is the way that most universities are starting to move when it comes to working in this particular direction.
Thank you, Dr. Hughes. Shifting gears slightly once more. How does Virginia Tech plan to support students who live off campus and may come into contact with people who are not vaccinated and will not wear masks?
I think, again, we would want to talk with them individually, and we want to know about their situation. We can't obviously control an off-campus space. We also can't control a person if they don't attend Virginia Tech. So I'm assuming the question is being asked in the context of a Virginia Tech person. We want to talk with that student. We want to work through that situation. If that's two roommates that are living together and someone is not making good health choices, we've always addressed those. 2 years ago, it wasn't about COVID-19. It was about other types of, either communicable diseases or other types of lifestyle choices that cause conflict between people that were living together. So we can work with those students. They can contact the Dean of Students office, particularly as an off-campus student, they're looking for a resource, contact the Dean of Students office, and we'll be willing to sit down with you and talk through. Now, can we compel, Sydney, could we compel you to wear a mask in your off-campus apartment? No, we're not going to be able to do that. But I think often what we are able to do is to be able to bring people together to talk through what's at the core of the issue here and the living situation. And this goes back to making choices about living with people that line up with lifestyle. And again, that's always been the encouragement for as long as we've been doing higher education and working with students who want to live with each other. So again, we can help people through, and a part of the, the personal responsibility dynamic that Chris spoke of a little bit earlier is equipping people to even know how to take that personal responsibility, giving people some sense of how they can enter into these conversations, or how can they, have a one-on-one conversation, for example, with someone to say, listen, this is impacting me in this particular way. I mean, so we have the ability and the tools to be able to help students through that. But again, we want to know those particular situations individually so that we can work through the dynamics of those.
If I can add one thing, Sydney, just to that kind of off-campus conversation is, I know we might have a wide range of students that are here, and some may be first-year students, but, for those that were here at least last academic year, if you remember, we went through a full year where the town of Blacksburg had mask mandates and some of those kinds of things in restaurants and even downtown, even just to walk outside downtown on the sidewalk, there was a mask mandate. Now, oftentimes, just like here on campus, oftentimes, it's difficult to enforce. There's not a lot of enforcement people everywhere along the way. But the reality of it is, Blacksburg as a town and as a community took away their mask mandate, some time ago, much sooner than what Virginia Tech did. And so we have been kind of used to that since way back in the summer. I think that's when they took it away, and all the way through fall, that, off campus, you could go unmasked. And so, it's interesting, of course, there's students on both sides of this issue. And, I would hear from students sometimes that would say, I can walk right across the street off campus and I can take my mask off and do whatever I want, but on campus I can't. And so I picked that point up just to say that off campus, we've been doing this already. And yet I still think that our numbers have, they've not peaked because what we're doing off campus, they've typically peaked in that move-in phase of people coming from all over the country and coming together. And as people settle in, our numbers typically settle down, and it hasn't had so much to do with whether someone's been off campus without a mask versus on campus with one. So, and that's more of an opinion, but it's an opinion based on, what we've seen and from someone who's kind of been in this since the start. So.
Yes, thank you so much. Moving forward, so many of the Virginia Tech BT buses are often overcrowded, and with a relaxed mask policy, what can be done for students who are unable to get to Blacksburg campus, other than through the BT transit? And are there any other options regarding safety and peace of mind?
Well, I think some of this, of course, depends on what are the requirements for transportation. So for example, the Blacksburg Transit is not controlled by Virginia Tech policy, so to speak. So if the transportation laws remain that masking continues, then they continue, right? And, in places like that, and kind of similar to what Chris was saying, health centers, it's likely that, it could be, for example, that if a masking requirement is lifted, that there might still be some stipulations that certain places would continue them, particularly in places where you have a good chance that people are going to be really close to each other. But if it should be lifted, and again, someday, the masking requirements, right, in total will probably be fully lifted. COVID-19 will still be part of our society, and there might be other variants that are at play at that time. But that's when we would certainly continue to stress the importance of what can you do, certainly to be able to protect yourself. And also it might be the adjustments that you make, for example, and when you travel. So, I've flown on the airplane once since, all of this started. And I have other colleagues that have flown often and friends that fly often. I've made a decision, not to do that because of right now, my thoughts about certainly what happens. And I'm getting ready to take a trip tomorrow and still wondering about, how's that going to go? I have another colleague here in the office who actually, that is their primary transportation is the Blacksburg Transit. And so they actually will wait a little bit after, the end of the workday at 5 o'clock and just kind of hang out a little bit. And then they go get on the bus because they know the bus is going to be, the occupancy will certainly not be as high at that time. So those are some of the pivots that certainly people make. But again, right now there is a masking requirement on the BT. I don't know if that will be lifted anytime soon, particularly if there are federal regulations that indicate that those masking has to remain there. So that's probably what I would say is, I think we're going to be pretty much okay with what's happening on the BT. And again, truly wearing a good fitting mask that works well. And as Chris, who oversees our public health folks here on campus, can tell you, their team has been wearing N95 and N95 masks since the very beginning of this. And Chris, I think you said often before that your team was up close and personal with, students with COVID-19, throughout all of this, and, still felt very comfortable, even, being protected, through the masking that they were doing, participating in.
Yeah, just, a personal experience is, Shiver Health Center, has been testing people with COVID-19, and you guys probably have used our testing sites. And, we first had a outside organization that was actually doing the test. And then we went, much like a lot of institutions have gone to self-testing, but we still have students that work in there. But, they have worn masks, they have done the right thing. And so even where we're closestly exposed to COVID-19 on this campus, I would say the majority, if not all of the cases that we've had especially when we get into contact tracing them back, have not come from somebody's job here at Shifford or somebody's job in one of those testing centers. And, I've had 2 experiences with COVID myself, and I'm in this building every day and have been every single day, and never once at home. And I've picked it up both times when I've been on trips. So I think I feel much safer on this campus than I do in a lot of other places that I might end up. And a lot of it's got to do with the mitigation strategy we've done. And quite frankly, it's got to do with how well the students and the faculty staff and the community has taken this seriously and done primarily what we've asked. And, there's some that are a little more diligent about the mitigation strategies than others. But, again, I will continue to refer back to the dashboard, but knowing our vaccination numbers and our booster numbers makes me feel better. So.
Thank you, Dr. Hughes and Mr. Wise. We actually received another audience question, so I'm going to go ahead and ask y'all that now. So the majority of professors have been extremely understanding regarding COVID safety. Is there any administrative requirement for illness absences to be excused?
Yeah, so we have always had in place with the Dean of Students Office an absence verification process, so that if a person is ill, and generally that has to be verified, by visiting with a doctor, they can provide that note or evidence of that visit to the Dean of Students Office, and then we will provide an absence verification to that student, which does not it doesn't excuse them from class and does not exempt them from anything. It just simply verifies for a faculty member that they have been ill or they've been something that is beyond their control that has prevented them from being able to be participating in class. Now, with certainly in COVID-19 times, because of the numbers of students that have obviously needed to make this virtual class, and some students are testing it at in doctor's offices like Shifford or at urgent care facilities, or some are testing kind of on their own. In those scenarios, there's been a lot of those that are quarantining, wanting to kind of sit tight because they are symptomatic. They haven't tested positive, but they're not sure, and they certainly want to play it safe. When they do reach out to us and let us know, particularly if it's a COVID-19 disclosure, we have been able to provide them something that they are able to take back to a faculty member to say, listen, I did disclose to the Dean of Students Office, and they did provide me with essentially kind of a letter or some information that I can share with you to let you know that I've registered a COVID-19 positive test result, and I've been told that I should isolate and for the period of my isolation, whatever that time frame is. So we've always had that in place to be able to do that. That will continue to be the way that we will support students that do become ill. And again, that is part of the process of how we are able to support students and to be able to make sure that even, that sickness or any type of illness, for example, for that matter, that does not take you out of class for longer than 2 weeks, we have the ability to help you kind of remain part of the academic experience.
And I'd just like to add too that Dean Hughes said it, but I just want to make sure it's really clear that your best stop for those absences is the Dean of Students Office. Shifford doesn't typically provide those. I know a lot of students come here assuming that it's provided by here. It's not. But if you've come to Shifford and you've had a medical appointment and you have your information about that medical appointment and you need to miss classes, you would provide that information to the Dean of Students Office, and they provide it. It keeps us from having multiple layers of confusion for our faculty and other people that get those reports. So the Dean of Students Office is the place to get those absence verifications, typically for just about anything, if I'm right.
Yeah, that's correct. So whether it's illness, it could be if you've got a court date, if you've got a family emergency or some other type of emergency that you need to tend to, if you have a religious or faith-based observance, we can provide absence verifications to be able to support that.
Thank you all so much once again. So we are out of time, but I do have one more question I'd like to ask on behalf of the students. So many students at Virginia Tech have only known a college experience dominated by the uncertainty of COVID. What can you say to students who are fearful, confused, and anxious about the changes that could still be coming to Virginia Tech's campus, even as we are living with the pandemic?
I'll take a quick stab. And certainly, Dean Hughes, you chime in too. Maybe it'd be good to hear from both of us on this one. But I just want to go back to the multiple tools that we have on campus and that personally folks have. And again, not to reiterate this too much, but a good quality mask, getting your vaccines and boosters, using the testing program, things like staying home when you're sick. One of the best things for healthcare professionals that COVID has taught us is that push through mentality of I'm sick, but I can still make class or I can still make it to work is how typically communicable diseases are spread, more so than just in everyday life. And so people staying home when they're sick and taking care of themselves and making the best choices for themselves and for the community are ways that folks can stay. But what I would like to say your point is well made. There are unfortunately a lot of students in this world that have had the last 2 years of their educational experience interrupted in ways that others have not. And for those that have never experienced Virginia Tech outside of COVID, I hope they get a chance to, and I think we're getting closer to that as we learn to live with COVID or whatever. But the in-person experience at Virginia Tech is an incredible experience, and I hope the two of you and others that work with students every day, that might remember that experience would share that. But it's that in-person piece and that Virginia Tech experience that you get here that is so well-rounded that it goes so far in an individual's educational environment. And so it's that we're trying to get back to, and it's that some of these decisions are made with data points we have, but we're also making it in what we think is the best interest of the student for the long term. And that is a good quality Virginia Tech experience. So I would encourage students to take responsibility for their health and for what they can do for themselves first, and then for the community immediately after that in how they choose to go about this experience, but to understand the value in an in-class, on campus, fully engaged experience and what that will do for all of our students in the future. And I think it's just important to know that our leadership is going to continue to monitor what we need to, and we will make the changes that are necessary to make to protect the community. There's no doubt about that. I think we and other institutions have proven that, right? But when we can have that really, really valuable experience that Virginia Tech is, I think that's what students should look forward to and feel comfortable that, we are all in this together, but it's about a whole 360 experience. And we've been really focused on COVID-19 a lot lately. And I hope that students don't miss any more of the opportunity that they have here as we try to work ourselves into something that's more like normal before, even if it never is completely like that.
I'm one who likes to spend a lot of time with students, and it was pretty much a fact that before COVID, you would see me at West End Market, probably with a student at lunch every single day, except for the weekends. So even for me, returning into this in-person experience with COVID-19 and, the uncertainty of what restrictions will be in place, it's even been an adjustment for me, particularly when thinking about the anxiety around, I don't necessarily want to always talk to a student behind a mask, but I carry that same sort of anxiety, right? And kind of confusion or fear of, but if I take it off, I could get COVID-19. And so I think that's a pretty real emotion. And particularly if you've only known the college experience and the past, and end of your high school experience, being in quarantine or isolation in terms of not being around lots of people and having masks and things that kind of keep you away from people. But part of the kind of climb and into a different way of looking at it and living with this pandemic is that we have to start doing it. So what we kind of compare that to is, when you turn up the lights and, you kind of turn the dimmer and it slowly kind of comes back on. It's not turned on all at once. The idea being that it takes an adjustment and, and you kind of work through it, and you work through it with each other, and you try on little ways and opportunities to start being around people. So, last weekend during the Super Bowl, we, for the first time in probably 2 years, invited a couple of our friends over to watch the Super Bowl with us. And, that was a big, big step, but, we know those folks and, very well. And, we felt pretty comfortable. We don't see them every single day, but we felt very confident. And, that's part of rebuilding the confidence to be able to start engaging, but then also reminding yourself that that does not go without taking that personal responsibility for your health. And so, I would say if you're fearful, if you're confused, if you're anxious, talk to us and let us know and let us be with you and kind of help you as you kind of work through it. Because again, we're all working through it together. It's not something that, all of us are trying to, or, have gotten right and have figured out completely how to do this. So it's a community response. We have a lot of colleague institutions that did end up having to tell students to go home, for example, right? Even after fall 2020 started. We were able to continue here mostly because we come together as a community and we take care of each other and we respect each other. And when we are not respecting each other, which we know that definitely happens in our community, then we're willing to draw, kind of attention to that. And then we rally the folks that are in positions like mine and Chris's to really be helpful in being able to do something different and to help students. So, heard from a faculty member 2 days ago. She said, I have a student that entered class and won't put a mask on. I said, well, he should be referred to the student conduct office. And he's being referred to the student conduct office, So we're not going to, just because things are changing, it doesn't mean we're not going to still call people to make good decisions and good choices on behalf of the community and to, again, not compromise people. But we're also going to know that, as this pandemic is shifting and changing, that we're going to be mindful of, where we are now is not where we were last semester or where we were a year ago from now, or even in March 2020, when we suddenly had this cast upon us. So, thanks.
Well, thank you guys again so much for making time for the students to share your insights. We appreciate it greatly. To Sydney and John and the entire Special Programs Committee, thank you for help coordinating this and reaching out to administrators to help bring this to fruition. Like I had mentioned earlier, this town hall is one way that we at the USS are advocating for students and creating avenues for you to share your voice. To further this conversation, we have members of USS going to Richmond next week to speak with state representatives, to talk about COVID, grants, and to learn more about how to be the best leader for you. Looking internally, we at the USS will investigate the reasons as to what influenced the decisions behind the policies that have been made and what will be in the future. We will work with administration to find out these answers and then relay this information to you, the students, in a different format. Since we didn't get to all the live stream chats on this call, we want to let you know that we will share all comments and questions with Dr. Hughes and Mr. Wise. They will be answering all of those questions and we will share those answers with you all. I want to thank everyone again for taking time out of your night to spend it here with us. We appreciate it and look forward to hearing more from you in the future. Feel free to reach out to us at uss@vt.edu or reach out to a senator or myself or anybody here. Have a great rest of your night.
Thank you, Caroline.
Thank
you, Sydney.
you.
Thanks, Caroline. Thanks, Sydney. Great job. Thanks, John Ainsley.
You all.